Well, June is Men's Health Month, a great reminder for men to stay on top of their health. And today we're talking with Dr. Eric Giesler, a board-certified urologist with Urology Austin. We're talking about things to watch for and the simple steps men can take really to save their lives. Thanks for being with us.
Absolutely. Thank you.
So I guess what are a few key symptoms men should not ignore, and what would indicate something serious to where you need to get to a doctor?
I think men are very good at ignoring symptoms, and I think some of the early symptoms that men can experience are changing in their voiding habits, whether they're getting up at night, going frequently during the day, things that they start worrying about how
bathroom
they're
habits.
Right.
Yeah.
And that distracts or interrupts their day, and those are things to start paying attention to, and maybe to talk to your doctor about that.
Okay, yeah, and we found out about former President Biden's prostate cancer diagnosis. With something like that so public, what would that mean for, I guess, men around America?
Right. Well, first of all, I'm glad he disclosed it. I'm glad he is now an advocate. Obviously, at 82, about 50% of men in his age group are found to have prostate cancer.
Oh, wow.
Not all as aggressive as his. He did have some symptoms, voiding symptoms, although I want to be clear that the most early cancer is asymptomatic, and that is why the screening is so important. I'm not sure what happened with him as far as screening, but generally it's recommended if a man, once they hit the age of 50, to start screening once a year, once every other year, and that's usually with a blood test and a physical exam.
Right. If
they have a family history, like myself, my dad, my two grandfathers, or are African American, they do recommend starting in their 40s with screening.
So when you say asymptomatic, you would almost have it full blown without you knowing the symptoms until it's too late. Is that?
That is absolutely right.
Okay.
And that's the sad part, is that this is why we screen for it, because it sort of goes indolent and silent for so many years, and then when we do find it, sometimes it can be advanced. The good news is that only about 20% of the people that we find to have prostate cancer are like President Biden, have it advanced, where it's an incurable state. 80%, if found early, which we do find, are likely curable. So it is a very curable, manageable disease.
And what other things besides like prostate cancer should men really keep an eye on? And what age should that start?
Right. I always tell men we're lucky. We get about a 50-year warranty. Once we hit 50, I'm about to turn 50 here in a few weeks, so I'm experiencing
You're a youngster compared to me, but
yeah. So we have to start paying attention to our bodies. I think you first know your numbers, know your blood pressure, know your cholesterol. The number one killer of all of us is heart disease or stroke. Number two, we want to know about our sexual health, our testosterone, our PSA for our prostate. So when we look at holistically the whole man, you want to, number one cancer in people, skin cancer. Number two in men is prostate cancer. Okay. So let's just own our bodies. Let's be proactive. Let's go to the doctor. We take our car, once or twice a year for oil changes. Can't we take our body once a year to get evaluated and be proactive? Right,
and that kind of leads me to my next question too. What's your message for men who avoid going to the doctor? Because, some of us, something happens, okay, I didn't see that, or okay, that's just normal, or I'm not going to think about it.
Yeah, I think we can all have excuses, whether it's financial excuses, whether it's time excuses.
We're going to make up some kind of excuse,
right.
Yeah.
So I think it's just, again, owning your body, and patients know their body better than anybody, and if things start not feeling right, don't look right, go get some, seek some opinion, get some help, and just make sure it's okay. Because if we catch things early, they're generally very treatable, manageable, and you can live a very long, healthy life.
I can say really quick too, you may have just answered my question, but say you go to the doctor and you get that diagnosis you weren't expecting. Okay, yes, you've got cancer, you've got prostate cancer. What's your immediate reaction? Should you panic, or okay, we're going to take care of this? Doesn't mean it's a death sentence.
Right, it is not necessarily a death sentence, and most of the time, like I said, 80% of those men are curable. Even former President Biden, he is an incurable state, but his average life expectancy just at with his diagnosis is probably 5 or more years, since it's a very manageable disease.
Gotcha.
I also think the C word, the cancer word, it's a mortality check. You hear that, you're like worrying about your kids, you're worrying about all those other things. And a lot of times these are curable and easily treatable, and hopefully we use them as springboards to get other parts of our life in order. And I see that in a lot of my men.
All right, thank you so much for being with us. Appreciate it.